LifeWave is not intended to cure, treat, or diagnose any disease. And so with that, doctor, I'd really like to start with, how did you learn about these patches? What was going on with you, as a doctor, a chiropractor for 38 years, working with many different modalities? Like, why did you even look at this? Why did you try them for yourself? And then why are you moving into utilizing them with your patients?
Well, that's a really good question. Quite a few questions there. But really what it comes down to is I was already doing a type of therapy in my office that uses photomodulation or phototherapy, which is what LifeWave patches are. And I was treating very successfully in my office for the last 8 years peripheral neuropathy. And this uses infrared light therapy, which elicits a way in which to increase blood flow. So when I heard about LifeWave patches and found out the mechanism had to do with the photo emissions of the body being reflected back in and igniting this amazing reaction to migrate stem cells for regenerative properties, decrease inflammation, brain function, circulation, it really got my attention because these were two parallel types of therapies that could prove very influential in my practice. So lo and behold, I went on board just to share a little bit of personal experience with LifeWave patches on my part. I had an accident with my shoulder working out and I tore a rotator cuff tendon. So as a result of that, I knew I was going to need to have surgery. But knowing that LifeWave patches have the ability to help with regenerative aspects, such as collagen improvement, reduction of any kind of scar tissue formation from the surgery itself, but just promoting the regenerative aspects of the body to recover from the surgery. I started using the patches about a month before my surgery very faithfully, and found out that after the surgery and how I was progressing after the surgery, I was actually completing my rehabilitation anywhere between about 8 to 10 weeks ahead of schedule. And for a person of my age, I'm 63 years of age and feel 20 years younger than that actually. But that's pretty remarkable for someone to be able to come back that quickly at this stage. So I would attribute a lot of that recovery to the science behind the LifeWave patches. So there you go. That's some of the background on that.
So Dr. Ray, I know that you have been a chiropractor for many years, and one of your specialties is treating peripheral neuropathy. I mean, you might be able to pronounce that better. And that tell us a little bit about those types of patients, what that is, how you treat them, and really what's happened now that you've added some of the LifeWave protocol.
Oh, great. I'm glad you asked that question. So peripheral neuropathy is a condition that's very common to diabetics, although folks that have had chemotherapy can develop it for cancer treatment, as well as folks that have also had cholesterol medication for a very long period of time. But in essence, it's a decrease in blood flow to the peripheral parts of the body, like the hands and the feet. And this causes nerve damage. The nerves are highly sensitive to a loss of oxygenation and nutrition and the removal of waste products. So by using this type of approach with the treatment I was using in the office, I was getting really good results. Well, just to give you an example, after about the initial 4 weeks, we do a screening to see what the measurement of improvement is. So we were seeing on the average after 4 weeks of treatment about a 20% improvement in patients in terms of restoration of sensations like feeling their feet better, standing better, balance improvement, hot and cold recognition. But then I started applying the patches as a protocol in addition from the start on some of these patients. And we were finding that on the average, the 20% was increasing to about 35% in the first 4 weeks. So for me, that was a big game changer as far as implementing that protocol of typically X39, using the Eon and also the LifeWave for pain control. Using those 3 patch systems for those 3 months in the beginning as a protocol was really a big boost to that neuropathy recovery.
Wow, doctor. And someone's asking, where did you put those patches on your patients?
So the X39 and the Eon patch go on the area just below the belly button, just like a snowman, basically, one underneath the other. And then the LifeWave, generally, because most neuropathy patients also have what's called a nerve impingement issue in their lower back at the same time, and that's where we apply the chiropractic as well. I was using the patches at that location. So we were getting the nerve from its origination point from the spinal column. And as it was working its way down to the periphery, down into the legs and the feet, we were getting an application of pain control as well from that application.
Wow, so you were patching LifeWave in the points of pain, and then that broke the connection of pain, and you were putting Eon for inflammation and the X39 to activate the stem cell repair under the belly button. Is that correct?
That's correct. And that's where I've had the most success using that location and that type of combination of patches.
Well, and you said something, and please let me know, because you have so many treatment modalities, but you said something about using a low-grade infrared light for neuropathy even before the patches came. What is that, and how is that different from the patches?
So I use a type of light system that will encase the feet and the hands, and it emits 2 wavelengths, near and far wave infrared. One of these are able to be seen by the naked eye, the other one is not. But these 2 types of wavelengths of infrared have an implied therapeutic approach into the blood vessels, namely the arteries, that are lined with a cell that emits a chemical called nitric oxide. And nitric oxide is a chemical that gets diminished with the aging process, but even more so in diabetics. So this neuropathy light, this infrared light that I use, actually helps to restore that and start to rebuild that capability. But here's the other kicker: when you put the LifeWave patches into play, you get a stem cell migration to help with that nerve supply, as well as the circulation improvement. The blood flows much easier through the arteries, and then there's also stimulation of the nerves as it relates to the lining of the arteries that can dilate or open up. So that's how you get more blood flow, in my opinion. I mean, that's when I'm basing the information on why I'm getting increased results as a result of using the patches along with my infrared system.
Wow, so you already understood that light was a healing modality, and maybe that is one of the reasons you were open to trying a wearable light technology.
Absolutely. I mean, knowing that a light system was an integral part of the healing process with neuropathy, when I found out that photo emission of the body, which is a light energy that comes off the body, and being able to harness that in such a way with the patches driving that energy back in to ignite this catalyst of stem cell activity, it made sense for me to look into it because I was already embracing the philosophy as we speak, and to see this working in another way made complete sense.
So you said something on the last call that really made me stop in my tracks. You said something about you felt more comfortable helping more severe cases now. What did you mean by that?
What I meant by that is, in my opinion, with the prior system of using neuropathy infrared before I started using patches, I established a kind of a line in the sand that I felt that it was just not feasible to really, unfortunately, help these people because the damage was just so severe. And so I made it a point that if a patient tested above, say, 75% sensory loss, I would not accept them as a patient because I just felt it would not be feasible for them to get results, and I just didn't want them to waste their time and their effort and not see success, because I want people to succeed. But I started looking at things a little differently with how the patches were modulating these improvements, and I started accepting a few cases, and I just told them, hey, if it doesn't work, we'll work on the cost factor and to help you out, but let's go with this and let's see what happens. And so I was accepting cases above 80%. I had one at 85%. Frankly, they were very close to maybe developing gangrene and losing toes, amputation. So we started using the patches, and lo and behold, they cut that factor back, and they started coming back and started coming back. So we've had just a tremendous ability to help those real severe cases now, and not turning those patients away like we were before.
Wow, that's amazing.
Yeah, it really is.
So, Dr. Peavy, can you also tell me a little bit, what's your thought about the patches on immune system, and what would be your choice for that and why?
Well, the immune system, as we all know, is a very highly talked about thing nowadays, certainly with COVID and just everything that's going on. Thankfully, we're seemingly coming out of the downward turn of that. But I mean, as far as the immune system goes, a big one for me is glutathione. Glutathione is just an amazing booster of the immune system. It's been one of those things that's been difficult for us to really harness by taking it from the outside in, because unfortunately glutathione gets denatured and lowered in its effectiveness because of the digestive system. So now we have a patch that can actually activate glutathione production internally, which is the way the good Lord planned it, and so that's a game changer. Then you start using things that can boost circulation. X39, which we haven't really talked about, is one. It's a parent to the X39. So I would say X39, Eon, X49, those three there, along with, I would do the glutathione, and I would actually throw carnosine in, because carnosine is also something that is circulatory based because of its heart health qualities, and it also has brain function benefits, and also, of course, I think it has a really big potent effect on the pulmonary system, or the lungs, or respiration. So those would be really my game changers as far as those 5 patches there.
Wow. And so you say those 5 patches based on being a chiropractor that works on neuropathy. And if I understand, a big part of neuropathy is increasing circulation or blood flow. And so that's those 5 patches in your mind. Let me just repeat, and we'll go over the patches in a moment, but just really interested on how a doctor is really using this. So it sounds to me you're using X39 stem cell activation patches to turn your stem cells on, to turn into the cells your body needs to repair. Eon to stop inflammation. X49 to help with the heart and brain health and blood pressure. Carnosine for the organ support as well. And then glutathione for your immune system. Did you say those 5?
Yes. Mm-hmm.
I like those 5 very much too, doctor.
Yeah. It's really an amazing complement to the various things that can be supportive in the body. So, I mean, that would be my recommendation for just about anybody to use that kind of approach. I've streamlined it a little bit, though, in the beginning with patients, the focus being the X39, the Eon, and the IceWave. But certainly bringing some of those other partner patches into play would be, I think, a really wise decision, if that's something a patient can move forward with.
Wow. Well, doctor, I really appreciate your time and knowledge. You can tell that he is an expert at his discipline. Is there anything else you would like to say before we move on that I have missed today?
I just want to say that for number one, it's a pleasure to be here tonight to be able to talk about what I do and certainly what LifeWave patches do. So it's just it's been a wonderful experience, and I'm looking forward to seeing it foster through. And the most important thing is, from my standpoint as a chiropractic doctor, my point of view is to try to give back lifestyle, lost lifestyle. And as I've mentioned before many times, we take a lot of things for granted, and when we can't do them, then it's really a big issue for a lot of us if we can't walk our dog, or we can't go out and play with our grandkids, or even just simply go to the beach and drive a car. I mean, neuropathy is something that affects anybody from the standpoint of just being able to push the pedals in the car. So. But neuropathy is just a small piece to a larger pie of things that LifeWave patches are able to really help. I just happen to be one that really uses that type of treatment quite a bit in my office, as well as good family chiropractic care too. But there's so much more. It's a very diversified product as far as what it delivers on.
Well, thank you, Dr. Ray Peavy. We so appreciate your knowledge. He obviously, his practices in Arcadia in Southern California. He helps many patients every day live their best life, as you said, and we really appreciate your knowledge of how you help your patients, and also how you've incorporated the patches and why it helps us understand better as well. So thank you for that.